Hey there, and welcome to my office. My name is Dr. Calliope, and I'm going to be performing your examination today. How you doing today? I see. I hope by the time you leave this office, you feel even just the littlest bit better. Now, I'm going to be performing this examination in a bit of a different order than you're probably used to. Instead of starting with, for example, the scalp, the face, looking at the eyes, ears, nose, mouth, and throat, we are going to work with a bottom-up approach instead. So we'll start with checking your reflexes, looking at your legs, your arms, so on and so forth, working up the body instead. Would you mind if I just confirm your name and date of birth? Okay. And is that your preferred name? And how do you like to be addressed? I would love to start by using my Taylor hammer right here to elicit some different reflexes, if you don't mind. Is it okay if I touch you to start this exam? Excellent, thank you. We're going to start with the jaw jerk reflex, which is one of those funny reflexes because you actually should not really have any movement at all with this one. I'm going to put my thumb right here, and I'm going to have you slightly open your mouth, and I am going to tap on my thumb here, right? So if you could just slightly open your mouth. Good. Good. Just like that. Excellent. Now for your arms. So we're going to start with the biceps reflex here. So I am going to take my hand and wrap it around your elbow here and place my thumb in the crook of your elbow. I'm going to tap on my thumb to elicit that reflex. Would you mind if I see one of your arms here? Okay, I'm going to get a little closer. I'm just going to wrap my arm, or my hand rather, around your arm, and let's get a few taps in there. Okay. Good. And the other side. Okay, so just putting my thumb in the cubital fossa there. Good. There we go. Now the triceps reflex. I'm going to be working with the back of your arm. So if I could just have you lay your arm across your thigh, and then I can get to the area I need to be here. So this is right behind the arm. We're going to do the same thing where I'm just going to tap this area. Good. Good. The other side. You could just lay your arm down. Good. Good. There we are. Now our patellar reflex is next. So I'm going to have you just relax the knee here. Let the leg go loose. And we are going to get right in here. Very easy one to elicit. There we go. Couple of kicks there. Good on the other side. Excellent. Okay, and now the last one is our Achilles tendon or our ankle jerk reflex. If I could have you just put your foot on my knee here. I'm going to hold your foot so that I get a little bit of tension on that tendon. And then we are going to tap the back of your foot here. Good. There we go. And if you could put the other one up here. Good. A little bit of tension and there we go. Wonderful. I'd like to test the strength of your legs here, starting with your toes. So if I could have you just pop your feet up so that your heel is resting on the ground, and I'm going to try to push your feet down from this position. I want you to hold against me, okay? So go ahead and pop your feet up, and we're just going to push them down and you hold against me. Good. Good. Now I'm going to have you just bring your legs up. So lift your thighs off the table. I'm going to try to press them back down. I want you to resist me. Go ahead and bring them up. I'm going to try to press them down. Okay. All right, good strength there. Go ahead and relax. So, let's go ahead and look at your feet. If you wouldn't mind just putting it back up on my knee here. Good. Then I can look at capillary refill, health of the nails, the sole of the foot. Make sure there aren't any injuries, that aren't any discolorations, any sores, anything out of the ordinary. Good. Okay, skin looks good on this one. And let me just squeeze the toes here at the joints. That way we can see if there are any issues with the joints at all. Was any of that painful? Okay, good. So other foot, checking the capillary refill. Make sure the circulation is good for the bottom half of your body. Skin feels pretty good here. Excellent. Nails look healthy. And I will have you just put your feet down. We'll take a look at your legs. I'll be doing some palpating here. And the shins tend to be an area that you find skin abnormalities. I'm also going to check, let's see, around the knee here. Is any of this painful at all? Good. So knee looks good, ligaments look good, and thigh looks good. Okay. Other side here. Okay, and any pain or tenderness with this knee? Okay, good. And the thigh. Okay, and skin is dry and warm. The joints are not hot. Okay, very good. Let's go ahead and move to your hands and arms. So let's take a look at the nails. So we're looking for any abnormalities in the nails. You'd be surprised what kind of health problems you can find in the nails. Look for things like nodes or xanthinomas. Look for any hemorrhaging. Good. The color too. All right. And so for the capillary refill, we press on the nail and it should blanch or pale. And then if the color returns within 2 seconds, that's indicative of good circulation. So we'll just run through the nails real quick. Good. Yeah, this looks good. Excellent. So, joints here, we are going to palpate distal to proximal here. And you just let me know if any of this is painful or tender. We'll just real quick give everybody a little squeeze. Okay. How was that on that hand there? Good. Not too bad. And then we'll also check the metacarpals as well. Okay. For the metacarpals, I'm just going to squeeze right in here. Let me know if that's painful at all. Okay. Other side's good too. Do you mind if I see your palms? I want to look at the thenar, hypothenar muscles. Any palmar thickening? That looks good. Okay. Alrighty, let us move to the arms. So let me check temperature. I'm just going to feel with the backs of my hands. And that's all dry, warm but not hot. Mind if I see your elbows here? Good. This is where we can find plaques. It is a good place for these to lurk. That looks good. Okay. Let's look at the rest of the arm. Any skin abnormalities? It looks good. Okay. Alrighty, so for some arm strength tests, I am going to have you just put your arms like this, okay? And I'm going to try to push you. I want you to resist me. So I'm going to press against you. Go ahead and hold. Okay? I'm going to try to pull you towards me. I want you to hold. Good. And if I could have you put your arms out to the side and have your elbows in a 90-degree angle there. Okay, I'm going to try to push down. Go ahead and resist. Good. If I could have you lay your hands out like this, I'm going to try to press them down. I want you to resist here. Good. Now, if I could have you make some fists, I'm going to try to press it down. And I want you to resist. Okay. I'm going to try to turn your wrist inwards. If you could hold against me. Good. I'm going to try to turn it out. If you could hold against me. Good. Good. That's excellent. So, let's see here. Good. Now let's bring out the stethoscope. Okay, so I am going to take a listen to your abdomen next. And then we'll do some percussion. We'll also do some palpation. So if I could have you just take normal breaths here. And I'm going to take a little listen here. Good. Oh, that would be the issue. There, I was wondering why I couldn't quite get the sound. There we go. Much better. Okay. So just breathe normally here. Good. Listening to digestive sounds. Take this out for a second. And now I am going to do some percussion here. What this means is I am going to tap along your abdomen as if it were like a barrel, for example. This technique actually was invented because of that concept where a barrel that sounds full of liquid sounds much different than a barrel that is empty of liquid or half full, for example. So we're just going to map the organs and listen for the contents of the abdomen. Good. Right. Good. There we go. So we're going to do some palpation now. And let me know if there are any painful or tender spots. I'm also going to be feeling for the size of the organs. See if any of them feel larger than normal, for example. We will just do some palpation here. Make sure the abdomen isn't tender. There's no guarding or hardness. How are we doing so far? Doing okay. Good. Glad to hear it. Feel free to, at any point, let me know if anything doesn't feel right. That is very important. Even just on the basis of we want to make sure you're comfortable. Okay, good. So let's go ahead and move to the chest wall. Now, with the chest wall, I am going to be doing our palpation and percussion first, and then we'll do our auscultation. So, let's take a look here. I'm going to kind of combine the heart and lungs here in the palpation and percussion aspect. So let's start with some palpation. I'm going to feel for some heaves and thrills with your heart. I'm going to feel for heaves with the heel of my hand, thrills with the flats of my fingers. So I'm going to see, for example, heaves are pretty self-explanatory. It's where we feel that heaving in the chest. And thrills are palpable heart murmurs. Just moving my hand around here. And then we'll feel for our thrills here across the valves. Good. Okay. And over here. Okay. And I want to map the apex beat here. So I am going to start at the sternum here. And we are going to count the sternal spaces. We're going to get down to the 5th intercostal space. And when we get there, we're going to find our mid-clavicular line here. And where these two match up, that is where the apex beat should be. We're just going to feel that right there. Good. Good. So I'll just have to keep that in mind for when we do our auscultation. Now for percussion, I'm going to do this on the chest wall. We're focusing on the lungs. Again, we're looking for spaces full of air versus spaces with liquid. So we'll start at the apex of the lungs here, comparing one side to the other. Good. Naturally, the sound gets lower as we go down. Okay, good. Do you mind just lifting up your arms real quick? Okay, we'll get to the lateral parts of the chest wall. Good. Good. Okay. So, let's go ahead and bring out the stethoscope once more. And we are going to start by listening to the heart. So we are going to come right here, and this would be our aortic valve area. And the sound of a heart beating is actually the sound of the valves opening and closing. Here we have our pulmonic valve, our pulmonary, semilunar valve, tricuspid right here. And mitral. There we go. Good. And I remember I put a little divot in your shirt here for the apex beat. And that is where it should be. Okay. Now I am going to listen to your lungs. Again, we'll start with the apices. And I'm going to have you take a deep breath in and out. Deep breath in and out. Deep breath in. Deep breath in. Deep breath in and out. And out. Deep breath in. Deep breath in. And out. Good. Now, if I could have you lift your arms up again. And out. Deep breath in. Deep breath in and out. Good. Now I am going to go around to the back of you, and we will do those same steps. I'm going to percuss the back of the chest as well as auscultate. Okay, so for percussion, we're going to start up here, move over, and go down. Okay, and then we'll bring in the stethoscope. Deep breath in and out. 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 I'm going to come back around here. Let's take some notes. Now we're going to move to the face part of our examination. We're going to start by looking at your lymph nodes and then your sinuses. So I am going to feel the supraclavicular nodes, the nodes in the neck, underneath the jaw, around the ears, and the back of the head here. So we'll start with the occipital nodes here. Postauricular behind the ears. Preauricular in front of the ears. Submandibular, submental underneath the jaw. And anterior cervical, posterior cervical, and deep cervical chain in the neck here. Using a very gentle touch. Okay, and supraclavicular above the clavicle. As for the sinuses, we're going to work with the frontal, ethmoid, and maxillary sinuses. I'm going to start by pressing into the sinuses, the sinus cavities. Is this painful at all? Okay, and how about right here? Okay, and here. Alright, and now I'm just going to tap along these areas. Any pain or tenderness there? Okay, let's go ahead and look at your nose, your mouth, and your throat. So let's go ahead And I'm going to have you tip your head back. We're going to look at the nose here. If this wants to cooperate here. Ooh, it does not. Oh, over there. There we go. Otoscopes. Gotta love them. Alright. There, now I can see that. Good. Okay, so septum's midline. And the nasal passages are clear and non-irritated. And you can see a little bit of the turbinates there. Those look good. Okay, would you mind opening your mouth? Alright. I need something with a little more power. There we go. Oh, just keep your mouth open here. Let me know if you need to rest your jaw. Okay. Buccal mucosa looks good. And palate. Can you lift your tongue to the roof of your mouth? Okay, that looks good. Right to the floor of the mouth. Excellent. And if I could have you stick out your tongue. Good, and say ah. Uvula, good, and its midline. And the pharyngeal wall there. Clear, no cobblestoning, no redness. Looks pretty good. Do you have any issues with swallowing at all? No? Okay. Now, let's take a peek at your ears. So first I am going to do just a simple little hearing test. I'll have you tell me what words you hear that I whisper into your ear. Apple. Tangerine. Papaya. Blueberry. Raspberry. Starfruit. Pear. Persimmon. Pawpaw. Fig. Dragon fruit. Strawberry. Blackberry. Banana. Kiwi. Date. Orange. Kumquat. Lime. Lemon. Cherry. Okay, well, certainly know your fruits, don't you? Alright, let's go ahead and take a little look in your ears. And now we're behaving. Very nice. So, let me look inside your ears here. Pull up it back. And there. Just take a little look inside the ears and make sure that they are clear, that the ear canal's clear, non-irritated, that the tympanic membrane is intact, no perforation. We can see the tip of the malleus, the cone of light, with our little signs. Okay, very good. The other side here. There. Now, the external auditory meatus looks would say those are some healthy ears. And I'm just going to take a little feel. Any of this painful at all? Good. All right. Non-tender. I'd like to test your eye movement now. So if I could have you look at my fingers here and just do the best you can and follow my fingers. Good. Okay, let's move you over here. Just follow my fingers, using only your eyes, without moving your head. Okay, let's bring them over here. Good. Some nice up and downs. Good. And how about side to side? Good. Let's go up a bit. Just keep following my fingers here. Okay, and down. Good. Okay, and I'm going to have you go diagonally up and diagonally down here. Good. Good. And now diagonally up and diagonally down. Just like that. Just like that. Good. And keep following these fingers as they go out and in, out and in, out and in, and over here, out, in, out, in. Good. Now, let's go ahead and look at my nose here. I'm going to take a look at your eyes. Just going to bring a little light so I can see them better. Okay. Good. Okay. The little lacrimal glands. And this clear eye, clear, gray-white irises. Very pretty. Pupils. Equal, round, reactive to light. Good. And eyelash distribution's normal. Eyebrow distribution normal. I'm going to pull the eyelid down and I want you to look up for me. Pulling down, look up. Good. I'm going to pull pull up and you look down. Other side. Look up. And you look down. Good. Okay. Conjunctival tissue also is pink, moist, non-irritated, non-red. Now, I am going to do a few tests with your face. I am going to do a simple sensation test where we test the trigeminal nerve, and I just want you to tell me when you feel the fingers on your face. Okay? Right. Good. Mm-hmm. Mm-hmm. Did that feel the same on both sides? How about that? How about that? Good. I'm just going to real quick check our mastication muscles here. If I could have you clench the jaw, unclench, clench, unclench, clench, and temporalis muscle here, clench, unclench, clench, unclench, clench. Good. Very good. Now let's go ahead and just test your expressions real quick. I'll have you raise your eyebrows and puff out your cheeks. Good. Smile real big. And close your eyes real tight. And make them real wide. Real crazy like. Good. Now, let's just take a peek at your skin here. Not too much left for this examination here. Good. Just getting that bit of ambient light to see if there are any little bits that stand out. But looks pretty good. So now let's go ahead and finish with your scalp here. Just going to do some palpation here. Let me know if any of this is painful or tender. Good. Good. And just look at the hairline. Around the ears. Good. Okay. That all looks good. Well, let's do our last few notes here. Here we go. Okay. Do you have any questions at all for me? Any questions? Okay. Go ahead and sign off then. And that will conclude our examination today. I'd like to thank you so much for coming into the office and having this exam with me. I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you'd like to help support the channel, there is a link to my Patreon in the description box below. I offer early access to videos, Patreon exclusive videos, and audio downloads of all my content. Quite a bit going on there. Thank you again, and I hope you have a whale of a day and a good rest of your night.